Hello, everyone. Welcome back to this final plenary of the conference and of the day. I hope you all enjoyed the breakout sessions that you attended. Let me begin by introducing myself. My name is Geeta Rao Gupta. I'm currently a senior fellow at the UN Foundation based in Washington, DC. I'm also a senior advisor to the 3D program for girls and women that works with local government to empower girls and women in Pune, India. And I'm a senior advisor to Co-Impact, which is a global collaborative for systems change with a core focus on, in fact, gender equality and women's leadership. But most relevant for today, I am chair of the Global Advisory Board of WomenLift Health, which is the organizer of this fabulous conference. I'm excited to moderate this plenary session. The title of the session is Gender and Power in COVID, 2 steps forward or 2 steps back. That's the question we'll be discussing. And as the title suggests, we will be discussing gender inequalities that this pandemic has exposed, and in some ways has exacerbated. And then sort of discuss the role of women's leadership in responding to that reality and building back a post-COVID world that is better than the one we are currently in, a world that's more just and equitable. We all know, and we've talked about this throughout the conference, that COVID has resulted in women experiencing increased domestic violence, greater care duties, more unemployment and poverty. It has also diverted resources away from other urgent health needs and services, causing us to sort of slide back in many of our health indicators. We also know that female-led countries have demonstrated exemplary leadership in this crisis. There have been 6 times fewer confirmed deaths from COVID-19 in those countries than in countries that have governments led by men. This session today will occur in 2 parts. In the first part, we will have a keynote speaker and then a small discussion, a brief discussion. And in the second part, you will have a panel discussion with 4 leaders. We are very privileged to have with us an incredible list of panelists. And let's begin by, please join me in welcoming the Deputy Secretary General of the United Nations, Amina Mohammed, whom I've had the privilege of knowing for more than a decade as a friend, and as we like to say, sisters in international development. Excuse me, therefore, for dropping the honorifics. Amina, just calling you Amina, if I may. So as you have all probably read in Amina's bio, she's had an illustrious career. Prior to being appointed to the UN in this particular position, she was Minister of Environment in the Nigerian government. And prior to that was Special Advisor to the previous UN Secretary General. And she was the one primarily responsible for bringing about the 2030 Agenda for Sustainable Development. But the accomplishment that I'm proudest of and most talk about a lot is when Amina and I worked together on the Millennium Project towards creating a roadmap for the world on gender equality and girls' education. So over to you, Amina. We'd love to hear from you first, and then we'll have a brief discussion.
Thank you very much, Geeta. And that, I have to tell you to everybody, it was a task force on gender and education. And that's where I really cut my teeth on gender. It was Geeta, my teacher. So it's wonderful to be with her here. Amie and my sisters, WomenLift Health, thank you so much, friends and colleagues, for having me. I'm really honored to join this year's Women Leaders in Global Health Conference with such inspiring women leaders, and on a day of International Rural Women. I know it says 2 steps forward or 2 steps backwards, but I'm only going forward and I'm stopping the slide. And so no backwards, just forward. And I know that the women leaders around the table today and in the field are with us. If there really ever was a time to step up for progress on women's leadership in global health, it certainly is now. Women are making up over 70% of world health workforce, but 7 out of the 10 global health leaders are men, and I think that that's worth underscoring. And at the current rate of change, it will probably take us over half a century to reach gender parity in senior management in global health. This real implications. Those who make decisions, set priorities, and allocate funding, and they have the power to choose who will benefit, and too often the answer is men. In the early days of COVID-19, it became clear that most personal protective equipment, PPE, was designed for men rather than women, although most frontline health workers were women. This invisible discrimination led not just to discomfort, but created greater risk for our women on the front lines. And this is just one example of how health systems are almost by default discriminating against women. We need to accelerate our efforts for women's leadership and move from words to actions. I think Gita mentioned women's leadership has proven that when they are in decision-making roles, things happen that are more inclusive, that are more urgent, that are scaled with more ambition, and we don't leave people behind by our natures. Ladies and gentlemen, 25 years ago, the landmark Beijing Conference on Women Global Leaders committed to increase the number of women in leadership positions in health professions, including researchers and scientists. But in 2020, progress is stagnating. In the broader areas of global health governance, research and development, women are nearly invisible. Photographs of health leaders during the current crisis are frequently all male affairs. In 2019, only 20% of the global health organizations were found to have gender parity on their boards, and 25%, a quarter of that, gender parity at senior management level. And there's just simply no justification for these figures. And I can tell you that because we had to make a concerted effort here at the United Nations when we said gender parity had to happen at senior management, but also middle management. It has happened for us, and we continue to push against all the other levels and the different constituencies. The barriers that prevent women from progressing into these senior positions start with inequalities in education and opportunities. They include wage gaps and the disproportionate burden of care and domestic responsibilities borne by women. Solutions need to be comprehensive and tackle both visible and invisible obstacles to women's advancement. It's not just a matter of justice and fairness. There's plenty of evidence that countries where women have led national pandemic responses have fared better in keeping the crisis under control. As I like to say, women rise for all, and women's leadership benefits everyone, the whole community. Friends, as we mark the 25th anniversary of the Beijing Platform for Action, it is a watershed moment for women's rights, and we must take the opportunity to assess progress and address remaining obstacles. That's why this gathering is so important. In the healthcare sector, this starts with providing women health workers with safe and decent working conditions, especially in the current COVID-19 context. It also means taking action to prevent and end the gender biases, discrimination, physical and sexual violence, and harassment at work that women health workers often face, particularly in our crisis context. Going beyond healthcare, women must be meaningfully engaged in leading and developing not just the response to the pandemic, but all the plans for building back a stronger economic recovery. We need to step up support for our leadership at all levels, from local communities to global organizations, and from science to politics. And as the late Justice Ruth Bader Ginsburg said, women belong in all places where decisions are being made. To support this work, we will need data that is disaggregated by sex. This is a call that we've had for the last decade or more. It is going to be the only way to measure the extent of inequalities and discrimination, and to shape evidence-based policies that will allow us to make that call of integrity for the investments that are needed. The intersection of different forms of discrimination and inequalities has had a devastating impact on global health outcomes. And policies, processes, practices that don't take women into account are harmful not just to women. By denying women's opportunities, we have to understand and we have to advocate the fact that they would be harmful to everyone. Of course, we never have enough time. We already are behind, but we can commit to the challenge of advancing gender equality in global health as a part of the wider agenda on the Sustainable Development Goals. Increasing women's meaningful participation at all levels of leadership really isn't optional. It's an imperative for delivering real transformation, equality, and better health outcomes for all, with lasting and positive impacts. What we hope is beyond COVID-19, that we don't go back from the pre-COVID era, that going forward, would land, I would say, also in our focus on an intergenerational transition to the younger generation that really must take up the gauntlet now, and we must get our shoulders behind the wheel to support them and support that future. Thank you.
Thank you so much, Amina. You made a very important point about handing off the baton to younger leaders. We've seen some incredible young women leaders in this conference over the last 2 days. So the question to you is, it's been 25 years since Beijing. Where do you see the greatest opportunity to truly create momentum now? You mentioned young leaders, but how do we give them the platform? How do we actually make that happen to create a more gender equitable world?
I think that we have made, there's been a lot of progress. We have learned lessons, and I think we need to build on what we know and what is working, but we need to scale that up, and the ambition and the way at which we come at it needs to be different and in tune with this next generation. It's no good bringing old tools to new issues and new players. And we may all have the right message, and I think the messages are very concrete and are just as matter just as much today as they did even when we had Beijing Plus 25. But the messages are different, and we need to acknowledge that and have them not just at the table, but leading. As I said earlier this morning, it starts from what you do individually as a leader, and how many of us really, as we look around the table, very few young people, and when they are there, they're at the end of the table. And sometimes it would be good for us to just yield space for that week and say to a young person, you're chairing the meetings this week. You're not giving them your job, you're just giving them the opportunity to experience what it is like to be at the top of the table, gain courage, gain the confidence with which we would like them to do that. So I think active steps around us, and then taking those out into the different constituencies and partnerships that we have. And really, as we said, calling it out where we don't see young people and the capacities built. I mean, I often come across some really amazing young people, and sometimes, after the meeting, they're asking how to do a number of things which I thought they already had the skills and the capacities to do, to carry on the ideas at the table. They don't. And I think that we need to find ways of making sure that the capacity and those tools are there with them to carry them forward. So still, build on what we've got, make concerted efforts to hand that baton over individually and collectively where we find ourselves in our networks, just as we asked for all, women panels or not to participate in all men panels. I would say now don't participate unless there's a young person in that panel, and then continue to build those capacities they will need. Not all of them are formal capacities, Geeta. Some of them are the one-on-ones that you and I can have with young people for just giving them insights in how to manage a room where the power is clearly not balanced.
Yeah, and mentoring has definitely come up as one key ingredient to nurture young women leaders as being important. But the point you made about leaning out, we ask male leaders to lean out a little and give women leaders a chance. Maybe the older generation of women leaders needs to lean out too and give younger women a chance at the table.
Absolutely. But just, listen to our daughters. They've got very strong voices and opinions, and listen to them.
I couldn't agree more. And you and I have some fabulous daughters. But looking back at your career now and the personal journey that you have taken to get to this point, what advice, what are maybe 2 practical things you can say to the young women leaders who are listening in on how they can succeed in what is yet and still a male-dominated world?
I think, the first is the mindset, right? You need to go in there with your shoulders back and your head held very high, and, believe that you can make a difference, but also understand that it's a journey. And that journey is pretty tough, a lot of potholes in the road, but it's the networks and those that travel with you and your story. Believe in your story, because that's what's called authenticity, and it strengthens you at the table. I think there's some things that we didn't learn, we just did it on the job. But I think that's what I would pass as the first piece, is that you've got to be ready mentally and physically and get into that space. Once you've got into it, stay very focused on the targeted interactions that you need to make. Let me take an example on COVID. So what is it that we're going to do different? You're going to tackle the stimulus packages. who make up the decision-making on the stimulus packages? How can you get voice and momentum and engage two people, the executive and a government, which obviously will put the plan forward, but what's more important is that it's going to be the parliamentarian that decides where that money goes. So very focused, build the momentum and the movement to get behind that, and rely on your networks, raise your voice, raise voices with solutions. We need to raise voices with solutions. Make the case, but bring the solution along, because that's what gets you through the door.
Great points, Amina. Thank you so much for that. Keep that flame burning within the UN. I've always said that parity is the first hurdle, but equality is more than parity. I often like to say that equality is parity with quality. So let's get to that next step soon, even with the UN. Thank you very much for all that you do, and thank you for joining us today. It was fun chatting with you. Thank you. All right, we'll move now into the second part of this plenary, which is a panel discussion with 4 powerful women leaders. I'll introduce them briefly here. You have their detailed bios. First is Dr. Carissa Etienne. She's serving her second term as director of the Pan American Health Organization, elected for a second time by member states in the region. She's an illustrious career in health, beginning with work in Dominica in the Caribbean, in her native country. Then we have Dr. Anita Zaidi. She's currently the Director of Vaccine Development and Surveillance and Enteric and Diarrheal Diseases, and soon to be the first time ever President of Gender Equality at the Bill and Melinda Gates Foundation. Prior to that, she was Professor of Pediatrics and Child Health at the Aga Khan University in Pakistan. We also have another Anita Bhatia, who's Assistant Secretary General and Deputy Executive Director at UN Women. She's in charge of resource management, UN system coordination, sustainability, and partnerships. These UN titles, Anita, always a mouthful, yeah? Welcome to you. And prior to being at UN Women, Anita was a senior executive in the World Bank Group and has a JD in law. I was interested to see that from Georgetown University. And finally, we were supposed to have Ambassador Delfino on the panel, but she couldn't make it. But we were really lucky to have Amie Batson with us to step in at the last minute. Thank you so much, Amie. We're delighted to have you on the panel. Amie is Executive Director of WomenLift Health, which is the organizer of this conference. She's done an amazing job in getting this organization off the ground and running, as you can tell from the way this conference has been organized. Amie has a 25-year career in global health and has worked in WHO, UNICEF, the World Bank, USAID, and most recently, prior to this, in PATH. So thank you so much for all of you being here. You heard Amina's remarks. Let's take a step back, though, and sort of think about why we need to have this conversation. So I have a single question for all of you, and if you can please take no more than 2 minutes to share your answer. What is a specific reason that you think that women's leadership is so important in this pandemic? What is it about women's leadership that makes it so important? What's the reason? So let's begin with Carissa.
Thank you, Anita. So let me begin by saying hello to everybody and recognizing that COVID-19 has triggered an ongoing global and local gathering of the minds, demanding coordination, participation, and democratic governance, including women's leadership and participation at the core. I want to talk first about leaders on the front lines. And I think this is particularly vital because the crisis has placed healthcare at its center, and women represent most healthcare workers and caregivers on the front line of fighting this pandemic. So this is, of course, inherent with concurrent risk. And as of 14th October, according to the available country information that we have from countries in the Americas, the number of COVID cases among healthcare workers total at least 660,000. And of these, reported 2,709 have died. And of those we lost, 72% were women. And women's work confronting the crisis extends beyond the formal health sector. They are involved in caregiving at home, and they are the home caregivers of millions of cases. And so for a more effective and universal health-aligned response and similar health emergencies, we must implement and support gender equality and gender leadership. I believe that women leaders are often best positioned to represent these needs. I want to give one example of what I would call exemplary and stellar leadership in COVID-19 in the Americas. I want to highlight the role of the Honorable Prime Minister of Barbados, Her Excellency Mia Mottley, the only female elected head of states in independent countries of the Americas. During the first 6 months of this pandemic, she was the chair of CARICOM. And it was so important, and she so skillfully convened the heads of state of the CARICOM region on several occasions. And she used that platform to ensure coordinated planning, decision-making, and action to ensure harmonized policies in the Caribbean and access to scarce resources, making representations at regional and global levels to advocate for and negotiate around the specific situations and needs of small island developing countries. And not merely for the Caribbean small islands, but also for globally. And she has maintained this leadership. And as a result of her leadership and the coordination of heads of state, the Caribbean kept their numbers low and were able to ride out the initial storm of the pandemic. Of course, now with the opening of their borders, their cases are beginning to rise. Over and thank you.
So why do you think it was that she was successful, though, Carissa? What made her leadership be so effective in that particular? Was there a particular ingredient that she brought to it as a woman?
So she was focused, she was enthusiastic, she was determined, and she used her skills well to pull what were all male leaders together and to get them to cooperate around what were their common issues.
So right, there was no Anita.
Conflict.
I see. Anita, Zaidi, let's go to you next. What do you think? What are the specific reasons that women's leadership is so vital now? I think you're
about is a subject where.
Yeah, go ahead.
Not really. Can you hear me? Yeah. So I'll talk about a subject that's very close to my heart, COVID-19 vaccines, developing and delivering COVID-19 vaccines. And so many of our audience may have heard about a facility called COVAX, which has been set up as a partnership between WHO, CEPI, the Coalition for Epidemic Preparedness and Innovation, and Gavi Alliance. And the facility together is charged with developing and delivering COVID-19 vaccines to the whole world, including people living in low and low middle income countries. Now, all of these three organizations, WHO, CEPI, and Gavi, are led by men. But underneath that, all of this vaccine work is being done by women leaders. So Soumya Swaminathan, who you heard from on the first day of the conference, was the chief scientist at WHO. At CEPI, it's a woman scientist called Melanie Savelle, who's in charge of products, clinical development for vaccines. At Gavi, Aurelian Ngayan. All are sort of in leading positions, bringing all of these organizations together to work for this common cause. How do we get vaccines developed and delivered for the whole world? And at the Gates Foundation, this is the kind of role that I'm also having to play, which is bringing everybody together from across the foundation who can contribute to COVID-19 vaccines development and delivery, and making sure that everybody is working well together, is collaborating, is communicating well. And all of these are skills that women excel at, right? And so what the current situation calls for is not egos. It calls for determination, perseverance, courage, and the spirit to work together and collaborate.
Thank you. Thanks so much for that, and particularly for calling out the names of the women scientists behind the scenes who are often, hidden figures. Luckily, the names you mentioned were featured, some of them, in the conference over the last 3 days. Anita Bhatia, let's turn to you. And from the perspective of UN Women, why do you think women's leadership is so vital? We can't hear you. We can't hear you, Anita.
Can you hear me now?
Yes.
Okay,
Yes,
good.
go ahead.
I was saying that, so thanks for the question, Geeta. The pandemic has shone a light on things that we knew to be true, but somehow couldn't see. And I think a number of things have emerged during the pandemic that we didn't adequately value before the pandemic. One of them, for example, is the value of teachers. You know, we've had to reevaluate, and lots of people are understanding just how difficult the job of a teacher is today. That's one illustration. The other thing that has become crystal clear during the pandemic is the burden of care that women carry. We knew even before the pandemic that women do 2.7 times the amount of unpaid care work that men do. But it is only the pandemic that has really shone a light on this issue and made people understand that the care economy is something that we need to worry about and take care of, because the unsustainable and unpaid burden of care became visible in a way that it wasn't before the pandemic. And then when you look at the data which Carissa shared on the women at the front line who are really carrying the world on their shoulders as they deliver healthcare services, you saw this made visible, this invisible role that women had. So, in that sense, the pandemic has made us understand more deeply some of the things that had been happening beforehand, but that we hadn't paid attention to. Now, what's this got to do with women's leadership? For me, that woman who's standing on the front line and delivering healthcare services day in and day out and putting herself at risk and carrying a burden of infection that is much higher than her male counterparts is actually a leader. You don't have to be running an organization or running a country to be a leader. So that woman is a leader in her own way. And we need to value those leaders. But we also need to value women in decision-making roles. And I think it's absolutely shocking that every time you turn on the television and you see who's actually talking about the pandemic, they're all men. There are just not enough women in these roles. And we knew before the pandemic that diverse decision-making actually leads to better outcomes, better development outcomes. We heard the data from DSG this morning. Amina talked about the fact that you actually have better health outcomes when you have female leadership. So, boy, if you ever needed an argument for why you need more female leadership, that's it right there. You have the data showing that your outcomes, both in terms of the health outcomes as well as economic outcomes, are better when you have women leaders, which is not to say that you can't have enlightened male leadership, because I think the whole issue of women's leadership cannot be addressed just by women. Yeah. This is a universal issue where men have to be engaged as well.
Yeah, thank you. Thank you for that. I think it's important to note that women are in leadership positions, even when we don't define those positions as leadership positions. They're at the front and taking decisions on an everyday basis. Amie, how about you? I'm sure you've given this a lot of thought in putting together the curriculum for the cohort of women leaders in WomenLift Health.
Yeah, I think it's important to remember that leaders draw on their experiences in life. They draw on where they've been involved, what they've seen, both as an individual with in their personal life, as well as a professional and in their area of expertise. And so when you have, when you don't have the diversity in the leadership, you're not drawing on those different lived experiences. So I think one of the really important things that women leaders are bringing to the decision-making tables when they're allowed to get there is they're bringing these different experiences. They're bringing a different understanding of how people around the world, often the marginalized population, the 50% of the women population, some of the kind of critical issues, challenges, and ways of thinking about solutions that could possibly work. And so it's that diversity of lived experiences that I think that women are bringing that are so important to serving all people.
Thanks, Amie. So I want to go back to Anita Bhatia only because I keep thinking back to Beijing and thinking of all the demands that we made at that point. And it's been 25 years since then. I know we've made some progress, considerable progress. The fact that we're having this conference is one indication of that. But what should we be seeing or demanding in this next phase in the movement for gender equality? From the perspective of UN Women, what are you calling upon us to ask for?
A lot, actually. And the reason I say that is because when you look at the progress under Beijing, as you hinted at, the progress has been pretty uneven. It's actually pretty startling that, you see a lot of progress, of course, on access to education opportunity. We've seen improvements in maternal mortality. We have seen some improvements in women's representation. But when you look at the fact that the world is 50-50 split between men and women, and you look at the real progress that has been made with respect, for example, to women's representation and decision-making, it's still pretty pathetic. There's no other word for it. And I think, what has happened today with the pandemic has just exacerbated issues for women around income, around health, and around physical security as well. So, there are a range of issues where life is actually worse for women now than it was just 6 months ago, a lot worse. And so I think there needs to be a sense of urgency and understanding just how deep these systemic problems are. That's for one. And so we are calling on governments as they start to implement the second round of stimulus packages to really be intentional about the impacts on women. Because the first round of stimulus packages of $10 trillion, which all governments are trying to push money out the door, simply did not pay enough attention to whether the benefits under these packages were reaching women or not. And of course, in some countries, it's really hard to get cash into women's hands because you don't have ways of finding women in the informal economy. You don't have digital identification systems. But, policy making needs to be done through a gender lens. So if I had to summarize in one single sentence what we're asking for, it's that policy making in response to COVID has to be centered on women, because you cannot build back better and you cannot have inclusive recovery unless you put women, 50% of your population, front and center. And that means thinking through a range of issues which cover employment, the informal sector, access to reproductive and health services, which have actually declined significantly during the pandemic. You can't say to a woman who needs an abortion, come back in 6 months. So, we need to make sure that those expenditures are maintained in the response and recovery. We need to make sure that we are maintaining girls in school because we risk leaving out a whole generation of girls. We need to make sure that we're putting the care burden front and center as an issue for policymakers and not a private issue. This is not a household decision. And we need to make sure that as we pump money out in the system, that this money is actually getting to women who are decision makers in their households.
Thank you for that. So Carissa, you represent a region in which many countries have been very hard hit by this pandemic. And typically gender inequalities, the most health responses get sidelined. Given what Anita just said, do you think that gender inequalities, gender norms have been addressed in the way in which countries are planning their response to COVID or implementing their response?
So Gita, I think that countries and organizations recognize that the incorporation of gender equality, not generally, but also in health emergency and disaster preparedness and response, that's important. But sadly, we really, if we need to be honest, we have not assured that this has happened. And there obviously are unequal, immediate and long-term impacts on women and girls. And so we are working to support the essential roles and needs within the COVID response for a more coordinated response that can identify and incorporate the gender dimensions of the pandemic. So as the COVID cases and deaths began to rise, we were working more intently with member states to ensure that protective equipment was available to healthcare workers, not just in hospitals, but also on the front lines, and so guaranteeing that women were able to be protected. I think the whole social reorganization of care is very critical, and that has to be a shared responsibility between governments, the markets, and the community and individuals themselves. And because of that, it is essential that we need to protect those who carry out the work. In July, PAHO and ECLAC, the Latin American Commission, we put forward a report, released a report that showed how intricately linked is the economy, the social protection, and health, and making the point that the persons who worked in the informal economy were at greater risk, and most of the people who work in the informal sector are women. And making the point that until we are able to address those needs of women, their social needs, unless we were able to help them with stimulus package or whatever, and unless we were able to control COVID, that countries could not expand their economy. And so we have worked with governments to do their plans that are responsive to gender and also to mental health issues. And women suffer disproportionately from mental health issues. At least they are more forthcoming with this. It exacerbates those who had this before, but also it is a direct result of the pandemic itself. And so we are driven by data and evidence, and I must agree too here that information is required. We are still learning things about the pandemic, but we lack the disaggregated data sufficiently analyzed that can help us to understand the issues that are gender-driven issues, the issues of gender equality, and how women can best participate both within their communities and exert leadership there, but also to ensure that within our plans and actions that we have a gender perspective. Over, thank you.
That's really heartening to hear. It's heartening to hear that those efforts are being made and that you're keeping an eye on that, because I think that's really important. Anita Zaidi, from your vantage point of being in the foundation, I'm curious to know whether you see opportunities now to really bolster women's leadership in the fields of science and technology, or in other fields too. Is the foundation sort of engaging in those areas and funding more women to rise in those fields or in other fields? What do you think needs to be done, and how is the foundation doing it?
So Geeta, there's actually a real opportunity right now to focus on these issues when we are in this whole paradigm of how do we build back better. And there's actually a lot of evidence accumulating from the private sector about what works to get more women into leadership positions. And we need to learn from those in the public sector and in the nonprofit sector. So for example, top level commitment at the organization from the top leaders that this is a critical area to focus on. Then enabling policies. So just having the commitment and then talking to people isn't enough. You actually have to have enabling policies that make this possible. So for example, how you hire, how do you promote diversity, equity, and inclusion in your hiring, in your retention, in your promotion, in your recognition. We also know that just one or two women in leadership roles is not enough to change organizations, and not enough to change decision making in those organizations. You have to have a critical mass. You have to have around 30% before women are in a position of influence to make change. And then identifying, we've heard this a lot in the conference, identifying male allies and champions, because women cannot do this alone. They need to have support from people, men who also think that it's important to have a diversity of thought and lived experience in how you're making decisions. So all of this experience needs to be translated into the nonprofit sector and in the public sector, in how we get women to rise in these organizations, but then also to think about, and Anita, Bhatia referred to this a little bit, how do we do programming in the post-COVID world? In our stimulus packages, are we taking input from women? Are we including them in not just decision making, but who are the beneficiaries and being beneficiaries of those programs? So those are all going to be critical, and measurement of all of these things and holding governments to account when these stimulus packages are, the next round of these are delivered, whether it's small business support and loans for both men and women, low cost housing, insurance schemes, rent support, whatever it is.
Yeah, thank you for that. I think you laid out very clearly what organizations need to do. It's not just the commitment from the top, but also programmatically what we need to keep an eye on. And the processes of planning and getting inputs are so critical to get the right outcome. Amie, given that you're leading an initiative that's taking very tangible steps to promote women's leadership and transform it in global health, what do you see as the opportunities for the greatest change, keeping in mind also that women are not a monolith, right? Women, there is, women of different races and classes, ethnicities, castes, etc., face very different barriers and challenges. So how can institutions focus in a way that recognizes these intersecting inequalities?
Well, I'd say, two major issues. One is giving women the space and the tools to be using their voices and their expertise and their talents successfully to be improving health impact. Requires ensuring women have the support they need. How do you navigate your pathway? And that support is through peers, it's through mentors, it's through coaching, it's through kind of learning from the experiences of others. So for example, at WomenLift Health, we're establishing what we're calling a leadership journey to be supporting these talented women to be able to kind of really leverage everything that they have and be the leaders that they are in expanding their voice and influence. But it's not enough to just focus on an individual. You have to be looking at the organization where they work, the society where they live. So it's also about, as Anita was highlighting, some of that organizational change, but it's really also about amplifying the voices of respected and trusted leaders in society to be elevating and amplifying these kind of the challenges that are being faced, the value that these women leaders bring, sponsoring them in the larger environment. But as you noted, women are not a monolith, right? Every woman is a part of being a woman, but it's also compounded by her race, by her sexuality, by other identities. And so, I recognize as a white woman from the US, I have privilege. And yeah, my privilege is not as great as white men, but I'm more privileged than many of my colleagues who are women of color in a number of environments. And so, as we're working to be advancing gender equality, both for the individual and organizations in society, we need to be doing more to ensure that diverse women aren't just consulted, right? But that, diversity in the women leaders are actually purposefully put into positions of power where they can be shaping the policy, implementing the programs, directing the funding. And, global health has been governed for way too long by white, male, global north majority. And the systems and our institutions are structured to both prioritize their voices and preferences and frankly protect them in those positions. And that's something that we collectively need to make sure that we are changing. So it's not controversial anymore to say that diversity improves outcomes. I mean, I think everyone now accepts that, and that really holds true for health. And we need to start putting ourselves behind that and making that change.
It's actually, I feel very optimistic about seeing that change happen within organizations, because the equity, diversity, inclusion mantra now is going beyond rhetoric, right? People are actually talking about policies that succeed. I'm going to shift now to the questions from the audience, from the participants, because several are coming in, and take one of these, which says, in these times when women have to balance so many personal and professional responsibilities, especially those who are mid-level managers, how do we build systems and policies that allow women to progress to senior leadership? So if they're going to take on more responsibility as senior women leaders, what are the policies and programs that need to be in place to allow them to do that, given that they're balancing so many different responsibilities? So maybe Anita, Bhatia, you want to go for that one?
Yeah, thanks, Geeta, and thanks to the audience member who asked that really good question. It is at the heart of building back better, figuring out ways that both public policy as well as private employers can make sure that women have the infrastructure, the support infrastructure they need to get back into the workforce. And as I said before, I think this is a universal agenda. This cannot just be a women's problem or a women's issue. Men have a role to play, and both the public and private sector have a role to play. So in terms of the men's roles, we need role models of men who are sharing care burdens. At UN Women, we had this initiative, and we still have it, called He for She at Home, which we launched during the pandemic, which was to share examples of men who were really playing their kind of rightful and taking on a fair share of the burden of caregiving at home. Because we found very early on in the pandemic that women were drowning in care responsibilities, having to take care of their own work, but also the children, the homework, as well as housework. So we launched this campaign, and it was actually been pretty successful, and we've had a lot of people join. So if there are men in the audience watching, I encourage you to become a He for She at Home champion. But beyond that, right, there has to be public policy that drives this. And that public policy means investing in childcare facilities. It means providing for flexible working hours. It means becoming acutely aware of the need for paid care leave, for sick leave, things that just don't exist in many countries. And then the private sector has a huge role to play. Anita Zaidi mentioned earlier, how we can learn from models from the private sector. And here I think, the private sector has a huge role to play, to say that they will create flexible working conditions for women to come back, and that they will not penalize women for stepping off the career track if they have to, and hold their jobs, keep their jobs for them if they have to take leave to take care of things. There's a lot that can be done. I'm hopeful that we can build those systems back, but it does require first and foremost acknowledging that there's a real problem and that there is an unequal distribution of the care burden.
Yeah. So are there, Anita Zaidi, within the foundation, are there particular policies in place to enable women to manage this work-life balance better?
We've actually had quite a bit of experience doing this right now. So, for example, at the foundation, we have family leave. It's parental leave, both the birthing parent as well as the father or your partner can take leave. Also flexible work hours. Right now, of course, it's with work from home as well. We're still at work from home at the foundation. It's a challenge for caretakers, whether you have children or whether you have elderly people that you're responsible for. I mean, COVID-19, as many people have said, it's just uniquely exposed all of the vulnerabilities in society and how much of those are covered by women, and it's women's efforts that keep society going. And in fact, the whole economic order of the world depends on women's care work, right? This is what COVID-19 is showing. Lots to do. I mean, this whole agenda is part of the building back better, and we're very committed to be a leader in this area.
Yeah, one of the issues I think in supporting women is making sure not just that you get women at the point of entry, that you're recruiting equal numbers of women, but also how you retain them. So one of the questions from the audience is, how do we prevent women from leaving the workforce at all levels? And I think some of the organizational policies that you mentioned, Anita, from the foundation of family leave and so on, helps. Childcare as a public policy helps with some of that. But are there other strategies, Carissa, have you within PAHO or seen in other organizations, or Amie, whoever wants to jump in, other sort of specific organizational policies that have helped to retain women?
So let's say in PAHO, we made deliberate decisions to ensure at the top of the organization there would be sex parity. We've also tried at the country level, at representative level, to make real decisions to prepare our female staff for ensuring that they can pass the screening exam, so we can have more women as country representatives. We have had significant difficulty ensuring that at our department director level that we have gender parity. And so we asked women why. And it is because they feel overly burdened with being also a mother and a wife, and don't have sufficient time for career development. And so we've had to put in place and are beginning to training programs that would allow them to participate in a flexible manner and not within set hours. They've also been asking for flexible work hours that would help them. But I think even when you go to your women in our rural situations, these women don't have access to health services within the time that those health services are open, because they are busy working at home or in the informal sector. And even opening times of our health services actually bar women from participating. Very importantly as well, 1/3 of the financing in health comes from out-of-pocket expenses. Women are more likely not to be covered by health insurance than men. And so women are denied access to services, denied access to education, possibilities to advance, because they can't access training and they can't access all of the other amenities that we are offering because of the fact that they have multiple roles to play. And I think it's important that it's important that we recognize this, because you want to be an excellent professional and a leader. You also want to be a good parent, and you want to be a good wife.
Yeah.
Or partner.
Yeah, that's it. That's the multiple demands. Amie, anything quickly to add?
I would just add that I think COVID has shown us that the things that we would have thought were unimaginable ways of working and working effectively are now becoming the norm. And so you don't have to be traveling 360 days of the year away from your family in order to be an effective leader. And I think learning from what we've seen works in this extraordinary time of COVID is going to be really important for helping ensure that women can find sort of different approaches, sort of more flexibility to be and contribute as leaders going forward.
Okay, that's wonderful point to make, Amie, because it's really true. We've all experienced it. It suddenly becomes more possible to have global conversations sitting in your home, like this conference has shown us. One final question for all of you, and we have literally just 1 minute more. So I want you to be very specific and brief. But if you were to look back at your own lives and now look at your jobs that you currently hold, what is the one thing that you commit to doing within your organizations to push for gender equality and women's leadership as you move forward? So whoever wants to go first, who would like to? Anita, Zaidi, you want to go first?
Sure. So, well, I am going to be in this privileged position of leading the Gender Equality Division at the foundation, which I am super excited about. And so from that position, a lot is possible internally at the foundation as well as externally for the world. One of the most sort of meaningful things that for me personally that I have had the privilege of doing from the foundation is sponsoring the WomenLift Health program. Is sponsoring the Women Leaders in Global Health meetings, this is the 4th meeting. And I would encourage everybody to join the October 20th joint plenary that we are having with the Grand Challenges, annual Grand Challenges meeting from the Gates Foundation, as well as WomenLift Health, where Melinda Gates is co-hosting this. And you will hear from her firsthand what her vision is for advancing women's leadership. Thank you.
Thank you. Carissa?
So I would say going forward, I would like to prioritize health and health equity within our national health planning and delivery process, focusing on the transformation of health systems based on primary health care, giving really very important consideration to the vulnerable population, Indigenous, Afro-descendant, and other vulnerable populations, but within this, ensuring that we have a gender perspective. And that's both now, but certainly as we try and build back better and to assure that we leave no one behind. Over.
Thank you for that. Amie, how about you?
So as the executive director of WomenLift Health, I'm absolutely committed to putting the full force of our resources, our training, advocacy, the ways we're working and giving the voice to partners to be, really supporting and equipping diverse women leaders around the world to be able to be contributing fully all of their talents, all of their expertise, and expanding their voice.
How about you, Anita, Bhatia?
Thank you, Geeta. Look, in my role, I feel so privileged that, we have the opportunity through UN Women to really help bring about, working in partnership with all of you and others, transformative change for women in the world. So I think my commitment would be to just use this leadership position to continue to push on the unfinished agenda, which is large. And 2 particular things I'd want to say is, one, because we are starting on the process of doing our new strategic plan for UN Women, I hope I can reach out to all of you, my sisters, for your insights as we develop this. We need to bring the financing agenda together with the gender equality agenda. We talk a lot about gender equality, but we need to talk much more about how we are driving resources towards that. And my personal commitment is I mentor a lot of young women, and I'm going to try to make sure I have enough work-life balance that I can continue to do that.
Okay, I've just been told that I actually have a little more time than I thought I had. So I'm going to do one more round quickly and ask each of you to reflect on your personal journey, getting to where you are, and share with the audience, because I felt in all of the sessions that have occurred over the last 3 days, those were the most powerful moments of the conference when women leaders shared their own personal experience. Share a personal experience of an obstacle that you faced and how you overcame it, or what helped you overcome it, or what was the one ingredient that moved you forward, that propelled you forward to get you to where you are today. Is that something I can spring on you at this last minute?
Sure.
Who wants to take that? Who wants to take that?
Well, I can
Anita,
go. I can go first because I have. Sure. I remember, I mean, I have a very specific memory about a particular event, which was a career junction for me where I could continue to be doing sort of esoteric, what I call esoteric scientific work as a pediatric infectious disease scientist versus solving real people's problems in the communities in Pakistan. And one of the areas which was a huge problem for the world actually was newborn deaths, where newborn health had never been seen as a public health issue, and all of that work was, in sort of working with poor, low-income communities, and it seemed would have seemed to many people not sexy enough. But yet, when I looked at this issue and I saw how huge that problem was, even though it was a big career risk, I decided that's what I wanted to do, and I ended up, just loving every minute of it, learning so much about community work and what works in low resource environments, which informs so much of what I do today. So it's taking
Great.
risk, not being discouraged,
It's
right?
taking risk and having a passion for, feeling strongly about the issue you work on. Who wants to go next? Caritza?
Yeah, so as you know, I come from a tiny island called Dominica, where I've worked for most of my career. And I was almost like thrust into regional public health leadership. I became assistant director of PAHO. And as a woman, you have difficulty coming from a small island. You have difficulty making the transition, first of all, to the regional level, but also getting the respect of the peers around you who automatically believe that because you are from a small island, you don't have that experience. And in my island, we had led the transformation of health systems based on primary health care. So I was coming with that solid on the ground experience and knowledge, and having worked across the health sector. And then after about 4 years or so, then I was called to go to headquarters as the Assistant Director General. So this is now a bigger pool. And my remit was to introduce health systems based on primary health care. And all of WHO had lost the language of primary health care and did not believe in it. And so I had great difficulty. I was presented with the difficulty of winning over WHO staff, winning over public health leaders, because they too, global public health leaders, did not want to hear about primary health care, and dealing with all of this controversy, great controversy, conflict, etc., to get us to where we are now, that everyone has accepted that universal health coverage is a goal, and that you can only achieve by transforming health services, health systems based on primary health care. It has been a tremendous journey that I hope I can document one day.
Thank you. Thank you. Amie.
It comes back to, I think, Anita's point about being, when something turns sideways on you, taking the risk and where it kind of can bring you forward. And I do, it's happened to me several times in my career. And I remember one time I was an immunization person for the first 12 years of my career, and was at the World Bank and leading some critical immunization work and financing. And suddenly, for internal politic things, I got blocked, and it was like, step back, on this work and give it to somebody else. And that was the start of my moving from just immunization to looking at health more broadly, and starting to work on things like results-based financing and how do we really drive financing to the bigger issues of across health, across maternal and child and infectious disease. And so it was turning that shocking moment of being blocked on something into a new opportunity that really opened up so many new avenues for me.
Thank you. Anita. Bhatia.
So
quickly now,
thanks, Geeta. Yeah, no, just very quickly, I'm going to say that I think it's really important to have good mentors on your journey. And I've been very blessed. There have been lots of people who have been there to support, to push, to question, to challenge. And I think without those mentors, and I can think of a few specific mentors at critical inflection points, I don't think I'd be where I am today. So I really do encourage young people who come to me for career advice and stuff, I say it's really important to look at what you're going to be doing, but it's also really important to look at who you're going to be doing it with.
Thank you. Thank you so much. Thank you for your flexibility in answering all of the questions that I raised, and for your inspiring remarks and insightful inputs. Please join me in thanking. If this was live, you'd hear an applause. So I'm going to applaud for you. Thank you so much for a wonderful conversation. This has been an incredible conversation and 3 days. We've learned some hard lessons from COVID, but what's been amazing is to be able to have a moment to reflect on the kind of leadership that's necessary to deal with this. So thank you very much. Thank you to all of you. Am I handing off to Amie now? Amie, over to you, because I know this is a big moment for you. You've brought to a close a conference that you took on despite COVID and organized it in this online platform that works so beautifully. It is the official launch of WomenLift Health to support organizations to be gender inclusive and to empower women leaders. Thank you very much to you and your team for bringing us all together, for teaching us that what we need is inspiring feminist leadership. That's the only way forward. And we look to WomenLift Health to pave the way for us. Over to you, Amie.
Thank you, Geeta. And thank you to all of the extraordinary speakers and moderators who have been sharing their stories and their expertise with us over the last 3 days. You've left us enlightened, engaged, and inspired. I'd also like to thank all our partners around the world who have worked so incredibly hard to make this event the success that it has been. I particularly call out the members of the International Steering Committee, our Africa, South Asia, and Global Content Development Groups, and our Global Advisory Board. And of course, my most amazing team at WomenLift Health. We've heard over the last 3 days that COVID has actually made the challenges of achieving gender equality even harder. We're seeing and we're living through what happens when leaders don't give equal priority to the health needs of women. We're watching women bearing the brunt of the social and the economic fallout of this crisis. And we're all feeling the barriers that women leaders face to being recognized and included at the decision-making tables where they belong. As we're starting to rebuild, strengthen our health systems and rethink how do we more effectively engage and deliver health, the world has a unique opportunity to learn and to do better. And doing better depends on equitable representation of women in leadership. When I think about what the world will look like with more talented women in leadership positions in global health, my brain is buzzing with the images and the powerful sentiments that have been shared over the last 3 days. It's a world where, as Ngozi Okonjo-Iweala said, we're unlocking the creativity and the leadership talent of what humanity offers, not just 50% of it. Whereas Barka Dutt noted, we have equality at home, which then allows us to have equality at work. Where we value and invest in diverse intergenerational leaders benefiting from their lived experiences. And Dr. Jala, the Minister of Health from Liberia, pinpointed it when she said, women must be involved in whatever activity we are planning for them. We should be the ones to come up with the ideas, develop it, and implement it to the fullest. All we need is the support to be able to do so. It's where established leaders are supporting young women leaders to challenge old mindsets, reimagine solutions, and demand change, with women at the center. And as Gitinji Gatahi and Julia Gillard noted today, where men are not silent supporters, which is effectively enabling, but where they are actively calling out sexism and supporting women's leadership. And finally, it's a world where each of us recognizes our power and privilege. And as the First Lady of Namibia, Monica Gengos, noted, when privilege is unearned, which she was highlighting in her case as First Lady, but which I might add can happen if one is white or a male from the global north, or even from a wealthier family. When that privilege is unearned, each of us must use it for the benefit of others. And as she challenged us, you must decide how to spend your social capital for good. We asked a number of people in global health what they thought the world would look like if more women were sitting at the decision-making tables. They paint a picture of a world I believe we are all committed to working for. I'll leave you with this video as we close this year's conference with the voices and visions of a future that's worth working for, not just for women, but for the health and well-being for all. Thank you all for joining us. And if you'd like to view any of the sessions you missed or rewatch any of those that you enjoyed, they'll be available on the conference platform today and available via the WomenLift Health website beginning next week. I look forward to working with many of you over this next year and seeing you in the 2021 at our 5th annual Women Leaders in Global Health Conference. This conference, I am delighted to announce, will take place in New Delhi, India, of course, COVID permitting. And now, let me pass the mic.
Having more women at the decision-making table in global health means governments across the globe will be dedicating more resources to health financing.
When women are in position of leadership in global health, gender equity is mainstreamed in health policies, programs, and interventions.
A world where every person has the autonomy to make informed choices about their health and their bodies and are able to exercise these choices by accessing care that is affordable, stigma-free, high quality, and person-centered.
When women are at the decision-making table in global health, we are more likely to have solutions that are empathetic to the health needs of the most vulnerable in our population.
Passionate and compassionate power comes together when women are at the decision-making table in global health.
We need strong leaders who bring a variety of perspectives from diverse lived experiences.
We will have a diverse workforce, and the systems will be created to enable men and women to reach their full potentials.
A complete revolution in health services. New products, services, and policies that are created by women for women.
By having women at the table, you tap into the potential of 50% of the world's population that has been underrepresented.
Male advocates can only strive to understand and advocate for women's health by proxy. Women lead and advocate from lived experience and can inspire future generations of girls to become leaders in the field.
I have seen that by empowering even one woman, you can empower her entire family.
The world will be healthier, more prosperous, more peaceful.
The future looks strong, collaborative, smart, informed, powerful, and hopeful.